He lost 2 daughters within about 2 months of each other. They were in their late 20s, and they both died in daughters in Lesotho. And so I spent about 3 years raising the money to build this maternity centre in England. 2 weeks for a period of 2.5 years. And we so carefully constructed this with love, brick by brick, to serve the community of Masanda and the surrounding areas. And so it has been a great privilege to get to this stage of this journey, where we heard with great delight yesterday we've had the first cesarean section. So thank you, Doctor, for that wonderful service. Excellence for all of Uganda in maternal health services. And so we were looking for partnerships in midwifery, nursing, and all doctors. We want to collaborate in that capacity. The only one that delivers at 9,000 at the whole of Europe is Liverpool Maternity Hospital, a place where I was born 56 years ago. I'm giving away my age. So we want to take some of the burden from a Bali Regional Referral Hospital. They're overwhelmed, we've heard that. But we want to complement them. It's not a competition, any of this.
Contributing some little money. And they thought that before the donors even come and kickstart, maybe let them contribute some little money within themselves and show that they are really in for the health sector to start and maybe buy land. And I want to request, I want to thank the area MP was part of the...
And Janet for having spearheaded leading this facility for some years. We pray that whoever is doing work in this place, in whichever way, may God richly bless you. I'm so humbled by the lease and the other partners
to help a special budget to be created for this centre. I think we're entitled to change the name of this from a maternity centre to now a maternity hospital. Now that we have delivered all the children, all the babies, and now had the operating theatre functionalised. So I'd like to rechristen this place the Nick Morn Maternity Hospital. We'll need to
building the primary school in Lesotho, but to start training community health promoters. And that changed this, well, it started the baby steps of changing this community. So we started with hygiene, which we know improves health, dry racks, making sure everyone had access to a latrine, which most of us take for granted, but that was not the case here. And this improved the health, and it gave the community hope. And the community health promoters have been amazing. We kept training more and more, and they went into the households. Each one
who has come in a labor, you cannot send her home. So make priority. As I said earlier, I'm a nurse and a midwife. I worked in the facility for 18 years before I went to Ministry of Health. And I worked in maternity for 10 years, continuously, before I worked as a nurse, 8 years in other areas. So you can make priority, but make sure we protect our mothers, we respect them, we really give them that honor to appreciate and also love our facilities, because these facilities are for them. When they don't come, we don't respect them, when they come for maternity, when we don't give them that right to really know that they have right to come, right to ask what services, they will cease and they will remain at home. And when they remain at home, they will become also account for the statistics of those who go on the other side of morbidity or mortality, which we don't want to see. And with all this, I want to say thank you, everybody. I'll take the message, and our PS is a listening PS. Our PS is a lady of action, especially all the top management. I will give her the report, and as Minister of Health, we shall be able to discuss that. As she came here and commissioned it as Health Centre 3, I am very hopeful she will be willing to come back as these honorables, because our hands are always tied. When we put it before them, they dilly-dally. And then they start, others one's mine first, the other one first. But please, have network in your members, have trust in them so that they are able to give, because our elevations also depend on funds which are available. We may want to do it. If the funds are not available, we can't do it. But with funds available, we are willing. Why not? Because when we elevate, this comes with more human resource. It comes with more super specialization. It comes with quality of care. So with all this, when we brief her, we are committed. I said we are committed as Minister of Health to support this facility in all the ways of what we could to make sure that the facility offers quality care in relation to what we would love to have for this level. And want to say thank you for honoring, thank you for loving our partners, thank you for your commitment as individuals.